prolactin production. That's the hormone that when a woman is breastfeeding is elevated because it helps to increase lactation of the breast. But you can have a prolactinoma at any point in your life, and if that's the case, it also affects your ovarian function and the menstrual cycle. So there are a number of things to look into if your cycle just does not come any longer. Other disorders of menstruation, often women find that their mood changes in the week leading to and of their menstrual cycle. Some people are very angry, some people are very irritable, some people are depressed, and we often hear it referred to as PMS. There's also a condition called premenstrual dysphoric disorder, which is actually a diagnosis that can be treatable with medicine, if not all throughout the month. In the luteal phase, which is after you ovulate, that's when a lot of women feel those symptoms. So our first line treatment is either an SSRI, which is a type of antidepressant medicine, which can help to stabilize your mood, or for some women, birth control pills, because technically when you're on birth control, you should not ovulate, so you shouldn't have a luteal phase. And so if you find that your symptoms around the time of your menstrual cycle or the week leading up to are so severe that it's interfering with your ability to function at work, to interact with your family, your mood is just horrible, then you don't have to just write it off as just PMS. It perhaps is something that can be treated with some medication. So it's important to talk to your doctor about those things. And when it comes to heavy menstrual bleeding, often our management is some type of hormonal treatment. So birth control pills, as I previously stated, usually come in a combination of estrogen and progesterone. They help to stabilize the endometrial lining, and they help to keep the hormonal level at a steady state throughout the month. So you don't have your usual up of estrogen and up of progesterone. You're just steady, so you don't ovulate. Your uterine lining is stabilized, and when you get to that last week of your pills, you have a withdrawal bleed. So it helps us to control bleeding. But for ladies that's not a good option because of their lifestyle or because of their inability to remember to take a medicine every day, there's other ways to manage bleeding. There's a vaginal ring, which also is a combination that you have to remember just twice a month. There's a patch that you have to remember weekly. And there's also injectable birth control called Depo-Provera. It's progesterone only. It's designed to work by making that lining so thin that you don't have much that's built up to shed, and it prevents pregnancy as well through other mechanisms. There are implantable birth controls that also help regulate bleeding. The Nexplanon is progesterone only. It goes into your arm for 3 years and releases a steady amount of progesterone. And then there's also a Mirena IUD, which is FDA approved for heavy menstrual bleeding, and it lessens your blood flow as well. There's a non-hormonal medicine called tranexamic acid that can be used up to 5 days during the menstrual cycle to lessen the flow, and this may be a good option for some women who aren't good candidates for estrogen or progesterone use, perhaps due to a history of cancer or some other sensitivity to hormones. So if you or someone you know is experiencing any of these issues with their menstrual cycles, please give us a call here at CWHBC. We have healthcare providers here that can help examine you, get to the bottom of what's going on with these issues. So please feel free to call us.